and welcome to the Academy by Acclivity Health Solutions. I'm one of our co-founders and the CEO of Acclivity Health, and we're going to kick off an interesting set of content in support of the market getting really smart about how to succeed in alternative payment models, value-based care, delegated risk models, and all sorts of other models that are making their way into the healthcare reimbursement mechanism. To tell you a little bit about why we think we can take this role and successfully educate the market, we lean on our success. Honestly, my life's work has been at the intersection of healthcare data and how data can be used to transform the practice of clinical delivery and models of care to ensure you get better financial outcomes from your extensive use of your own clinical teams and practice transformation. Like those combinations of tech, data, practice transformations really are the things that are the backdrop of my life's work in healthcare. To that point, we've surrounded ourselves in Acclivity with some of the best healthcare economics teams, actuarial scientists, technologists, data personnel. And when you put all of that, thought leadership together around a single table, you have the opportunity to achieve incredible success. In the public sphere, where you can look at us against the rest of the market, you'll see in the Medicare shared savings organizations, we achieve better than 60% per patient in average savings, greater than 60% of savings per patient in MSSP ACOs. We more than double that when the organization is an ACO reach, which are double-sided risk arrangements, so 2.2% average net savings rate. So that's a little bit about who we are and why we think we should take the helm of sort of educating the market around how to achieve these kinds of metrics and success in value-based care arrangements. To tell you a little bit about our content, we're going to spend the time with experts around the table. I'll lead much of our content to start, but many of our experts I mentioned previously are going to also jump in and join us throughout these particular work streams as we talk through this kind of content. Like, what does it mean to be in value-based care? What are the different players, risk-bearing entities, participants, providers? What kind of models exist? How do you get started? What does it look like to have a good contract? What kinds of data are now available to me? How do I use that data across my technology and emerging technology? How do I build coordinated care models of care? What are the most important metrics to measure and manage? What do I do as an administrator? How do I focus the energy and the team on the right things? What do I do as a clinical leader, and how do I focus my clinical model of care to the right kinds of approaches to care delivery? How do we get early wins, and then how do we ensure those early wins remain and continue such that we have consistent financial outcomes? So this is the first of our content created for this particular academy. If you want to suggest more content, have ideas around what we might dive deeper on, feel free, as always, to reach out to us at info@acclivityhealth.com. Thanks a bunch, and look forward to seeing you in our content as we deliver it through the Academy. Take care.